Hello, everybody. Welcome back to Skin, Self, and Everything Else. I'm Brandon Mitchell.
And I'm Dr. Ellen Turner.
And we're back.
Yes.
How are you today, Dr. Turner? Tell me all about it.
Feeling very good.
We have a good topic today. We got a good podcast.
Yeah, I'm feeling good about our topic today.
I think so, too. We always have good topics, Dr. Turner.
We have so many things we like to talk about.
Life, skin, everything.
Yes.
So, do tell. What's the combo today?
So I thought we could talk about complications.
There's that's definitely a topic. Oh God, here we go. That is definitely a topic.
Yes.
That's for sure.
They're a real thing. I think
it is a real thing.
I'm always quick to say if you're not having complications, you're not doing enough procedures.
You tell me that.
As an aesthetic provider. Complications fall into two categories. We can have real complications and we can have perceived complications. And I think today I want to talk more about perceived complications. So the difference really between the two, as you know, Brandon, real complications, those are the ones we need to really jump on top of, treat those appropriately. There's protocols for those, and we need to take care of the patient, obviously.
And let's be real. Mm-hmm. You're going to have complications.
Right.
No one can escape from it. It's just you're not going to escape it, right? And remembering that complications is how we grow and how we learn. Mm-hmm. I'm not saying go out there and mess up somebody's face to the fullest extent and say, hey, I learned a life lesson. Right. But I'm just saying things are going to happen as a provider, especially the busier that you get, it's going to happen.
Right. I think as an injector, I know anatomy, but there's anatomical variance, and even in the best of circumstances, you might have a situation. There's things that happen where patients don't follow instructions.
I was fixing to say, because whenever that happens, don't always assume that it's you.
Oh, and that's what we're going to be talking about with regard to the second category. So I kind of want to delve more into perceived complications, because as I was preparing for this podcast, it prompted me to write a blog this week about this same topic, because I thought, I've changed a lot as I've become older and been in practice longer, because I think as a young provider, as a young dermatologist, I was such a perfectionist. I mean, I still am a perfectionist. I can't change that about myself. But I think I was quick to blame myself. Oftentimes, if something went wrong, I immediately assumed, oh, it has to be me. It has to be me.
I do the same thing.
And I think I want to step back and let's start to look at perceived complications. So what do I mean by a perceived complication? So you have somebody come in, you listen, of course, to what they want, and you make really good assessments on what do they actually need, and you make recommendations. You perform procedures on them that are perfectly executed. They have amazing results. And then you take photographs before and afters, and let's say, they've even signed photographic consents. So now you're going to publish those photos on social media and your website. And, we were just laughing about this the other day, because we had a patient that came in for his medical visit, totally unrelated. Mm-hmm. And it was kind of these, one of these, oh, by the way, doctor, as my door was on the handle, and my hand was on the door handle. I'm sorry, I said that incorrectly. And he said, I didn't get any result from that procedure. In this case, it was an Emsculpt Neo treatment. And, keep in mind, we weigh the patients, we do the photos, all of that. And he was on our website. We were so ecstatic with his results. We were like, oh my gosh, these results are amazing. And, it was like, at one, he never came back to review those amazing photos. That's one thing. But two, it was a super busy clinic. I didn't have time to sit down and show him those amazing results. I was, 5 deep in patients that needed to be seen. Brandon had another patient that he was in a treatment room with, so we couldn't stop and sit down and show him those amazing photos. But the bottom line is he was like ready to launch into liposuction surgery, invasive, like totally different. And I think at that moment in time, it's like the best I could recommend was you need to come back and sit down and let's really evaluate, let's really look at your results, because you got such amazing results. We actually posted them everywhere we could. We were so proud of your results. But at the time, like, he didn't see that. Perhaps it was because he looks at himself in the mirror every single day and he doesn't see the dramatic change that we saw. Or maybe it's because he has somebody whispering in his ear, oh, you need to just go to lipo, suction, and like maybe his trainer has a deal going with his plastic surgeon. I don't know. We don't know all the ins and outs, but that so often can happen where there is so much emotional baggage that as clinicians in the aesthetic arena, there's a lot more to the story that we don't always pick up in the consultation process or in the treatment process. And even if you get a home run or a touchdown, however you want that analogy to take place, the bottom line is that may not take place in the mind of the patient. So now you have this perception that you haven't met the criteria of success. So how do you come to terms with that as the provider? So what do you think, Brandon? I mean, what do you, in all of your years in aesthetic medicine, how do you sit back and rectify those two perceptions, you the provider versus a patient?
I mean, number one, like you discussed, before and afters are crucial. Good before and afters. And you want to make sure that you get an actual software. We have a software that we use here that keeps photos very consistent, keeps them the same, keeps before and after the same, right?
Right.
I think that's crucial. But I think, always making sure, number one, that when a patient is they're in their last procedure, like for Emsculpt Neo, for example, if they're due a package of 6 or 8, whatever it is you do in your practice, making sure that they get scheduled for their final photos. That's very important. And have you noticed, men are hard to get back in here for after pics.
I know a lot of patients are hard to get back in.
I don't know. I've noticed it in men. I'm like, get in here and get your after pics. But just sitting down and being able to show and going over, the pictures to show the difference, because 9 out of 10 times there is a difference, right? We have to remind the patients. They see each other what am I saying?
See themselves.
Thank you. Oh my gosh. Yeah. They see themselves every single day. So they're not going to see change. I mean, it's a proven fact that when you look at yourself every single day in the mirror, you are not going to see change.
Right.
And so I think 9 out of 10 times whenever we sit them down and we go over those before and afters, they're always, not always, but a good majority of the time that they're happy with the results, right?
Absolutely.
But don't be mistaken. You're not always going to make everybody happy. I mean,
that's true.
You're just not. There's sometimes you can't. You've won the battle,
right?
But you're not gonna win the battle. Does that make sense?
Yes,
like you see the results and there's visual results, but the patient is just there. You're gonna have those patients, and that's just part of the business. Yeah. But I just think that, to get back to the original question, because I gotta be long-winded about everything.
I love that about you.
I gotta be long-winded about everything. But to get back to the original question, I think it's very important in the consultation process to set up proper expectations and to make sure what the machine is going to deliver, or whatever procedure you're doing, what that machine can deliver versus their expectation, and trying your best to align what you can deliver with their expectations. Because I have been in a consult to where Sometimes it's a very small chance. I mean, it very rarely does this happen, but I have been in a consult to where you can tell it's going to be a red flag.
Right. No, I absolutely believe that.
And that it's sometimes better not to move them forward.
I agree. Yes.
I mean, I'm not going to lie. That has very few times has that happen.
Right.
But we're in sales as estheticians and
Right.
providers. We're here to make money. That's what keeps the wheels turning. That's what keeps us all getting paychecks. I mean, so we've all been, I'm going to speak for myself, we've all been to where, oh gosh, I got to make more sales, and feeling that pressure that you're not bringing in enough money, that we've done, we've made decisions that we shouldn't have made. Poor decisions based on pressure.
Yeah.
When you just have to take a step back and know that it's sometimes better to turn a patient away
Yes.
than it is to move them forward.
Yes. It's not worth it.
It's not worth it
It's
because
just
now
not
you have
worth
a
it.
domino effect. You have bad
It's not worth
reviews
it.
out there. You have slander and all this stuff going on. And again, it's very rare that happens, but it happens.
Or in an effort to make the situation right, you end up spending more money in the long run because you don't want, a bad perceived outcome to end up being, walking around out there. But yes, I mean, like, for example, you and Lauren both came to me a perfect example of that, where you said no. We had a new patient come in, and she swore up and down that she had at her previous place 12 units injected in all three areas: her forehead, her frown lines, and her crow's feet. 12 units of Botox Cosmetic injected. Well, the clinical trials for Botox Cosmetic are a total of 64 units. Okay, so that just does not even reconcile at all in any shape or form. So when you get to those kinds of numbers, the bottom line was we said no and let her walk away, because we know that she's not going to get anywhere near a clinical result from 12 units as compared to 64. There's no way. So, she can go down the street or she can go back where she came from, but that I would rather say no to something like that than risk having no results from that little small amount. And, that's just not going to give her an adequate rest to those muscles. So
it's important to keep control of the consult.
Yes.
Because we don't want the patient taking over our consult, and we don't want the patient telling us how to treat them or do our job. I mean, they come to us, they're coming to us, but I mean, it's just always, and if you feel a patient doing that, you don't have to be mean, because we're not in the business of having bad customer service. It's all about presentation, but there are ways to where you can be very bold and very tactfully take control back over that consult. Because I have told people, and the very few occasions I've said, I don't think that this is the right practice for you.
Yeah, in so many words.
Yeah, I mean, because I don't think I can give you what you're looking for.
Mm-hmm. Right.
And so you would rather make that decision up front.
Yes.
But we have to know the difference.
Yeah.
We don't want to miss out on a good opportunity. We don't want to miss out somebody that because I swear to this world, what did we do without Google? I mean, I could do brain surgery on you today, Dr. Turner. We could Google brain surgery and and everybody. I mean,
those guys, they go to school and they go to train for like 14 years, and it's like, oh, yeah, no, I could be a neurosurgeon. Really?
I mean, Lauren had a consultation last week to where the patient was Googling in front of her every single thing that she said. And Lauren, I love it. Lauren was very nice about it. She goes, so we're not going to Google everything I talk about today, I mean, because Google doesn't know everything, guys.
And they don't know the context of the situation either. There's so many different facts to put together to come up with the ultimate plan that's going to work for that particular person in that particular situation. So yeah, I think it's important to trust in your providers, and then that plan will work out, because there's a lot of things to take into account. So yes, I think you're so right. Education, photos, and then be there
Yes.
Be aware and try to see if you can help the patient work through these perceived complications. But if ultimately you can't, then I think at the end of the day, sometimes, they may have to go elsewhere. You may have to just say no.
Yeah.
All right, but one device we know works, and we mentioned it, is
Emsculpt Neo. Guys, this is like doing 25,000 crunches in 30 minutes, and that's not an exaggeration.
No.
Like when you get off of that machine, you are literally sore like you just did, not right away, but in a good way, that good workout sore.
A little slightly tender, but
yes, and it's like doing 25,000 crunches. It uses radio frequency in combination with electromagnetic current, and so it's going to melt unwanted fat, and it's the only device on the market that will get that hard visceral fat.
Yes, exactly.
It's very hard.
On both.
Yeah, visceral fat as we get older is one of the hardest fats to tackle.
It's impossible. This device is incredible because it works on fat while it also tones muscle. And what I like about it as a functional medicine doctor is all of these wellness benefits. So now we have both the aesthetic benefit, but we also have the wellness benefits. And they're really talking so much about that. So 33% increase in muscle strength, Brandon.
Yep.
62% improvement in pain, stiffness, and physical function. 49% improvement in physical function and disability. 83% improvement in range of motion. I mean, these are amazing things that...
I love it for the functional aspect.
Oh my gosh. When we start getting into, gosh, I'm already there, 55, and I'm like feeling like, I need to start making sure that my core and my range of motion is still there so that I don't want to be some elderly 80-something-year-old. I want to be like active. I want my core to be, I want to stand up straight. I want to be just as active as I am now.
I have to tell this. I'm thinking this and I have to say this.
Say it.
Oh my God. I cannot, I'm 47. Hello, yes, I said it and proud of it.
Yes.
Earned every one of these wrinkles, right? But
What wrinkles?
Thanks to you, Dr. Turner, but let me tell you, no, there are wrinkles.
Oh.
I'm a huge, I'm almost addicted to spray tan. I mean, I am, right? I love spray tan. I feel like it can camouflage because I don't go out in the sun.
As long as it's not a real tan.
No, spray tan. I was in there I had just been sprayed. I was getting ready to get dressed, and I had saw a crease under my butt that was white. and I was like,
Emsculpt Neo,
hell to the no. Do you understand?
Time to lift.
No. And I am not having it. We are not having a white crease. And so I'm like, I'm getting on that Neo. No questions asked.
Yes.
No one's stopping me. I may even reschedule a patient to do so. I'm just kidding. I would not.
The patients come first, but you come
and I swear, I was like, hell. And you know what, guys? I want to also say that Emsculpt Neo is not to take the place of the gym.
No,
okay, it's not going to take the place of the gym, but because I'm saying this because a lot of personal trainers and stuff, if people ask about it, they say no, you can get that in a gym. You can get that in a gym. They work together. It
does, but Brandon, some people physically cannot go to the gym. They're at a place where they physically cannot work out due to an injury or illness or post-surgery, and this device can actually take the place of the gym for those people. So there is hope. I used to talk to a guy that worked for BTL Aesthetic, and I loved it. Adam used to say, fit or fat. BTL, Emsculpt Neo, fit or fat. So, I mean, it really is a device for everyone. So that's what I love about it, is whether you need it for aesthetic reasons or whether you need it for wellness reasons.
Right.
I love this device. So, yes, I mean, it is for the bodybuilder group.
Well, no, what I was trying to say, you're right. I guess I didn't come out to it. I was just
You're a gym rat. So
I am, but
I know. So
I was just trying to tell personal trainers that you don't have to steer people away from it.
You don't. You do not.
That's all I was trying to say. you're
do
absolutely
not.
right, but
Yeah.
because sometimes your personal trainers, they're afraid we're going to take their business, and that's not what.
Not.
It's not at all. It's
True,
enhancing
yeah.
what you're doing.
It can,
and
but
it maintains
yes,
results.
But yes, it is for those people that literally, if they cannot work out because they have had, a physical debilitating issue, then this can get them over that hump to where they now can start moving and walking, and so it's an incredible device. That's what I love about it. So,
And for all you providers, you will not find an easier treatment to perform on a patient. It's so easy. You hook them up, you're in and out, and you can multitask. The treatment for like the abdomen on the Emsculpt Neo is 30 minutes. So I hook them up after you've done your before pictures, multitask, go do charting, do notes. It's so easy. I mean, it's really easy for a provider.
Yeah.
It's a great asset to have to your practice.
That's awesome. All right, let's get into some personal details.
Oh, my favorite.
So,
my favorite.
I went to a new Mexican restaurant.
Do tell.
I had talked to, in the last 2 weeks, 2 people who, and I thought I knew all the great Mexican restaurants in all of Dallas. Okay,
Is this the one I pronounced the name wrong?
No, I
Okay.
haven't even eaten at that one.
Oh,
We're gonna go there though.
We are.
Yeah, so I haven't eaten at Las Palmas.
And when I,
And
always,
he called it Las Palomas.
No, listen, with
and
my
I was
southern
like-
accent walking
I
in there,
was-
I was like, Dr. Turner, can we go to Las Palomas?
And I was like, is that this one? And I pulled up some restaurant named Las Palomas, and it's kind of like, it looks like sort of like I don't know, some kind of a third-rate, like, fast food joint place. I mean, it's like a taqueria thing. And you were like, no, that is not it.
That's not it.
And so it's not Las Palomas. It's called Las Palmas. But we're going to eat there. That is, like, so hard to get into. You got to, like...
Months.
Yes.
Well, weeks.
Yeah. So we're going to go there. And so we'll tell you all about that experience. But, no, I went to this place called Los Carlos Elegante. And it was like authentic Mexico City Mexican food. They're known for their masa. And we had the best waiter. He was so good. Can't tell you, I can't remember his name. But anyway, it was really, really good. I love beets, and they had the best beets. I loved it. But no, I would say my top 3, though, still my top 3 Mexican restaurants in Dallas are The Mexican. Love that place. It's just it's delicious.
And
it's
that's
so
a
elegant.
design district?
It is.
Yeah.
It's right next to the Virgin Hotel. And then I love Mi Cocina. It's just
that's my favorite.
standby. Yeah, love it, love it, love it. And then I probably would say, if I had to pick for the third one, there's a lot in my top 3, but I would probably say, it's so hard, but probably Mr. Macero. Yeah.
Is it?
Yeah, probably. I don't know.
Where's the one that we eat at? And we went there 2 weeks ago. And
I would probably Muchacho.
Yes.
No, I'm gonna swap it then. You're right.
I knew
I
it.
like Muchacho for 3 now because that's my new favorite.
I heard the margaritas are pretty.
Yeah. Oh, they're so good.
I heard they're pretty good.
Oh, and the queso, the brisket queso there is so good. At
We're going
Muchacho.
after work.
Yeah.
As a matter of fact, we're going
so
now.
Good.
Just kidding.
Okay, so what are your top 3?
But honestly, Mi Cocina is probably my top 1.
Mm-hmm.
It really is. Mi Cocina. I love Papacitos.
It is good.
It is good.
Really
I'm sorry. I
good.
I do.
I like it. Yeah.
And probably the third one's going to be Chiloso. We talked about that before.
Oh, I like their queso. I had never eaten there, and their grilled meats are so yummy.
I'm a big Chipotle eater too.
Yeah. Yeah.
Because I work out all the time, and I'm single. I never cook.
Yeah.
If anybody wants to come cook for me, that'd be great. I never. It's like I told Dr. Turner when I start dating.
Ask him, does he cook? I know he's a foodie. He's a part of a separate club, so.
I'm embarrassed about that because when you get tied to this one,
yeah. You're gonna be going out to eat, or
unless you
picking up Uber Eats.
I'm not a good cook, and the things I do know how to cook, they're not really nutritional.
Oh, well,
so
it's okay.
But
We
anyway,
don't all have our, you're good at some things, you're not as good at other things.
cooking's not one of them.
Yeah. All right, what is the derm trivia question of the week? Oh, okay. Brandon, you might know this. So the question is, what is the name of the bacteria responsible for acne? Do you know it?
Why am I drawing? Hang on.
You might know it.
Hang on. Let me sit up in my chair. Hang on. Let me see.
The bacteria responsible for
Give me a
acne.
hint.
No,
a hint. I need a hint.
All right, I'll just tell you. It's P. acnes. P. acnes is the bacteria responsible
That's
for
right
acne.
up there with that Neovivotus thing we talked about. Like I have no.
All right, good. All right, so Brandon, wrap us up.
All right, guys. So, as a reminder, all providers out there, please go to drallenturner.com for all the training tips and tricks at your fingertips. It's such a great website. We've worked so hard at it. Remember to tune in to us every single Thursday at 3 p.m. I know we're on
3 o'clock.
3 o'clock, and we're on Spotify. Mm-hmm. We're on Apple, and now we're on YouTube. And I think we were going to iHeartRadio. We're trying to get on there, but fingers crossed, we're working on that. So you can catch this podcast if you like what you hear every Thursday at 3 p.m. And as usual, we really thank everybody for listening to us again, and we'll see you next time.
See you next time.